Today, we're turning immunization coverage into a data story. At the end, you will create a phrase or a deliverable that could be used for health reports or community health needs assessments.
Data is essential, but it doesn't create change on its own. It's only powerful when people can understand it and use it.
Measles was declared eliminated in the United States in 2000. Now, in 2026, the U.S. measles elimination status is at risk. What are immunization rates in your county? Are the rates below recommended coverage levels? How much does a community's immunization rates have to dip before we see a rise in measles? The measles virus is highly contagious. 9 out of 10 people who do not have immunity to the virus who are exposed will end up getting sick. To prevent measles, 95% of the population should get 2 doses of the measles vaccine. Once 95% of people are covered, the disease has a hard time spreading from person to person, and we achieve what is called community immunity. So when immunization rates dip in a population, the first disease we often see is measles. Let's build a portfolio project. We've provided tutorial kits below. All right, step number 1, find the data. Where's the data? Step number 2, pick up your data tool. And step number 3, make something using the data and the data tool. All right, step number 1. First of all, where's the national data set on county-level immunization rates? We're going to be using the Johns Hopkins Center for Outbreak Response Innovation, or CORI, measles dashboard. This free data set is available to the public and pulls together state-level immunization data across the U.S. into a more usable national format. But there's something important to understand. The data is stitched together from different states. Different states report immunization rates in different ways. Definitions and reporting methods can vary. Now, what can the data tell you? What are immunization rates in your county? Are the rates below recommended coverage levels? Now it's time to pick up the data tool and make something. To learn a little bit more about Airtable, this is where I hand the mic over to Diana Saad.
Today, we're turning immunization coverage into a data story. At the end, you will create a phrase or a deliverable that could be used for health reports or community health needs assessments. In Oconto County, Wisconsin, there were 36 confirmed cases. Vaccination coverage was 81%, which is below the community immunity threshold of 95. This may increase the risk of measles transmission in the community. The information that I had put into these other columns will automatically pop into this phrase. My name is Diana Saad. I'm here to guide you step by step so you can leave the session with practical skills that you can apply right away. So today we'll be learning how to use Airtable and how to collect data pertaining to immunization coverage. And then you'll compare vaccination coverage in a county versus the World Health Organization recommended coverage, which is 95% or higher. So let us pretend we're a collaborative of public health departments writing our community health needs assessment. Let's say I'm from Oconto County, Wisconsin, and the immunization coverage was 81%. That doesn't really give us much information. So when we compare vaccination coverage to the collective threshold, we can actually get a bigger picture. In Oconto County, Wisconsin, there are actually 36 confirmed measles cases. Vaccination coverage was 81%, which is below the collective immunity or community immunity threshold of 95%. And this may actually increase the risk of measles transmission in that specific community. So we have more to tell a story with. This is basically a pretend example of how our deliverable or phrase can be used for a community health needs assessment. The red arrow is basically pointing to your deliverable that you will create, and you will get it in Airtable. So what is Airtable? Airtable is a digital tool used to organize and track information all in one place. So think of it as a mix of Excel, Google Sheets, and a project tracker, but it's smarter because it allows you to manage more complex data without needing advanced technical skills such as coding. Airtable helps you create a story with your information. So you can organize information such as health indicators, statistics, data sources, community partners, stakeholders, and more. One of its strongest features is its automation. So it allows users to create workflows that automatically trigger actions based on specific conditions. So for example, Airtable can actually send notifications, update records, generate reports, or sync information across tables without manual input. These automation capabilities help streamline processes, reduce errors, and save time, making Airtable a very powerful tool for managing public health data. With Airtable, you will each be given a template titled Immunization Rates by County. And so you'll start here. This is just an example. You will then choose a specific county or region. So for instance, I had chosen Oconto County to focus on just because of the high number of confirmed cases. It was 36. Really wanted to dive into that. So Wisconsin, this is also a drop down. It's a linked record, which I linked it to the US states. This is a great dashboard that has all the information for immunization coverage when it comes to the MMR vaccine. The shading has to do with the immunization coverage. So if you click down here at this little multiple tabs, you can take a look at the immunization, how they record it, the coverage, and then compare it to the recommended, which is 95%. It is recommended 2 doses, but some states do record the data as just 1 dose. Some states, including other vaccinations such as DTaP, meningitis, and things like that. And then the population, which also can vary from kindergarten to, I've even seen it as 2 years, as well as the change in years. For Wisconsin, it was 2 doses of the MMR vaccine, and then the age was 5 to 6, and then the years, which is 2024. As you can see, it does vary state by state. And then you will put in the county region immunization coverage. So for Oconto County, it was 81%. And then under this column is the community immunity target, which will be the same for each record, which is 95%. And then it's comparison, so lower or higher. And then number of cases that are confirmed. If you hover over, you can see these little darker orange circle, and that will show the confirmed measles cases. That's from 2025 to 2026. Sometimes states will record the information as regions as opposed to specific counties. Virginia does that. What's great here is you can create formulas. I included a formula with our phrase. Automatically, your formula will create this phrase. So if you're curious about the formula, you can always take a look at it with this drop down, edit field, and you can take a look at how I formulated it. But it's cool to take a look at the different formulas that you can create. The next is attachments, which are just basically AI generated images of your county. So Oconto County, Wisconsin. And then of course you'll include your data source and then your status. Also, I wanted to mention there are actually various views. Like you can take a look at the gallery view and kind of shows each record all in one place, which is really nice. The Kanban view as well, which can be stacked by specific columns. This is higher or lower. There's different views with Airtable. And really, Airtable is great because you can really make it your own. So that's Airtable in the most basic form, a very basic view of what Airtable could be. Cool.
Let's build a portfolio project and make something. We've provided tutorial kits below.